Testing. 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 Alright, Section 6, Rescuing Operations. Chapter 4. Rescuing operations. Introduction. Primarily the function of the rescue operations perform all emergency procedures with the necessary to recover the personnel with the situation, prohibit the escape of the first consideration. Firefighters are always having saving life. The function may be performed by 1. Comforting the victims of the hazardous situation, moving the victim to a safe place, giving the 3. Giving the essential physical state of the victims. Whenever possible, the removal of the victim to the safe place must be made without further injury. Extreme care must be taken into removing the personnel who appear to be injured. Some sample fractures, example, may become compound fractures, may develop into the more serious event, even fatal injuries, unless the victim is moved properly. The different ways of removing casualties are supporting the carrying by stretcher and lowering and raising the victim. 448, the carries, helping the victim walk properly in the simplest, easiest rescue method provided with the victim is to be able to walk at all. The method should be not used unless the rescuer is sure that there is no severe injuries that would aggravate so doing. 2 methods are used: one-man method or the 2-man method. One-man supporting care to perform the one-man uninjured arm of the victim is placed over the rescuer's shoulder behind the neck. The rescue grabber is the victim handed with the pass over his arm under the victim's waist, and this way the one man may support help or slightly injure the person walking. The 2-man supporting carrying. 2-man method is similar to the 1-man method, except for the victim and the put it on the arm, the shoulder behind the neck of each rescuer, each with the grasp of the hand, but then the put of the other arm around the waist, thus giving them the added support. The 472 shows this way practically for the entire weight of the victim can be borne with the rescuer. 449, fireman's carry. Fireman's carry is the easiest method of one man to carry, and another is accomplished by the following 7 steps. Figure 471 shows support carrying, 2-man support carrying. Figure 472. Alright, figure 473, fireman carry. Step 1, turn the casualty face down, knee on the one end of the knee on one of his head, place both of the hand under the casualty's armpits. Place both hands under the casualty's armpits. Gradually work down the side across the back. 2. Raise the casualty to the knees. 3. Take the firm hold across the casualty. Take the forward while holding the casualty around the waist with the right arm. Grasp the casualty right wrist and your left hand and withdraw his arm over such a way that a procedure must be performed with the opposite side. Similar change with the right hand, but continued by the described. Standing the right for the left and vice versa. Step 5. The beyond the waist and the knees, pull the casualty right arm down over the left shoulder, so the body comes over the shoulder. At the same time, pass your right arm between his leg and the grasp of the right arm right with the knee. Step 6. The casualty is lifted and straightened up. 7 in the figure. Grasp the casualty's right wrist, and leaving your left hand free. This is a position for you to carry. A man can carry another some distance in a manner. A man can carry another some distance in this manner. 450, pack strap carrying. Place a pack strap carry over the back under the arm of the victim. Lift the casualty, turn around, retaining the holding arm of the body with one hand. Grasp his wrist and with your hands hoist him with the armpits as you over the shoulders. This is a good way to carry an unconscious casualty. Do not use if the casualty has any broken bones. Since both arms are free, the rescuer may proceed down the ladder through the difficulty patches. Although the dangling legs of the victim are awkward and he cannot slip from the load, the rescuer can shift the load from the back of his leg muscles, bending forward. 451, 2-man carry. The seat carry, the 2-man carry of the Anglo-Piston consists of meeting a set rest of the one pair arm of the back rest of the other pair. Figure 475 shows the arms arranged completed with the rescuer kneel over either of the victim near the hips and raise him the sitting position steady with the arm of the nearest to the head around the back. Each slips the other arm under the victim's thighs, clasping the wrist of the other. Both our eyes all wait slowly in unison, lifting the victim from the ground when they were erect, when adjusting the upper body to form the comfortable backrest to make the victim secure and if conscious, the assist the rescuers grasping each of the men around the neck. All right, figure 474 shows the pack strap carry. Figure 475 shows the arm seat rest. Carrying the extremities is a good method for the carrying a person, but not usually in the case of the leg of the back injury. The victim is laid straight on his back of the feet apart. One rescuer takes his place between the victim's legs and the other in the head, facing each other. Both men kneel, raise the victim's head, shoulders to be sitting in the position. The man of the victim's head grasping them from the around the bodies under the armpits of the one between the victim's legs. Turn around and purpose with his hands from the other side outside under the victim's knees. Both of the rise together with a move and forward step. Figure 476. A two-man chair litter carry may be used if the common chair is available. Two men place in a victim on the chair, and then with one on the front and one on the behind, the grasp the chair conveniently, tip in back, and walk forward in unison as shown in Figure 477. The chair serves as a litter. 476, extremities carry. 477 shows the chair litter carry. 452, severe injuries carry. In case of the severe injuries, number of the rescuers should be increased to be at least 3. This makes it possible to transport the victim with the least possible bending of the twisting of the body. To make carry the more effective, all efforts should be coordinated to do so in the group, but they must be commanded with the common practice of at the one victim's head with the commander, the leader of the crew. This applies especially with the three-man crew. The three-man crew is accomplished by following the vowels. 3 men will line up on one side of the victim, leader to give the word with the prepare the lift. Each man kneels with the nearest the victim's feet, which one with the man with his shoulder, one of his hips, and one of his knees. With the further orders, they pass their hands and forms under the arm of the A figure 478. This one hand of the head placing the hands under the victim's neck and the shoulder. The next place the hands under the pelvis, the small back, and the third under the knees and the ankles. At the command of the lift, they raise the victim and place him on that knee. It is by releasing the hand. B figure 478. All right, C, at the command of prepare to raise, they slowly turn the victim on the side toward them until he rests on the bend of the elbows. At the command rise, all the slowly will stand in the position holding the patient closely against the chest. If the space permits for the rescuer to move the forward with the command of the march, starting off with the left foot, its space will not permit the moving of the forward, but they move the sideways in which the command side step left or right is given with the rescuer step off the front of the air according to the command, bringing the over the foot, and even though the short step of the victim is lowered and placed in reversing, operation allows the commander to command of the leader. 453, lowering and raising the victim. In a situation where the victim is not on the ground, not at ground level, natural exits are blocked, he must be rescued in some other means of escape. In fire rescues, they usually involve the lowering of the victim, although the rare cases it may be involved with raising him. Escaping, the method commonly used by the rescue squad with the fire service is made by ladder. Shows the figure A, B, and C of the severe injury carry. 478 shows the lowering the victim down the ladder, which probably looks harder than done. Looks it's harder than done than looks. Lower victim with a rope from the ladder. From the outside, if the victim is conscious uninjured, may be guided with the down ladder with the window or other opening is shown in figure 479. Generally, a victim is unaccustomed to going down a ladder, especially under an emergency situation. So great care must be taken to make sure that he does not fall. The rescuer goes down below the victim and keeps the arms around him, one knee between the victim's legs to assure the support in case he becomes unconscious. Alright, should the victim become unconscious, the rescuer let himself down or strike with the knee to proceed with carefully with the ground. If the victim is unconscious, not so serious injured, he may be carried down the ladder by a pack strap method. Unconscious victim may be lowered from the upper floor from using the ladder left line. A small handle line is not safe for the practice, although it may appear slow compared to carrying him down the ladder. A method may be safer in one carrying conditions. Procedure as follows: as the ladder is raised with the point is just above the window where the rescue is to be made. The first man takes the end of the lifeline at the bottom of the ladder and passes it underneath the bottom run. And at the end of the held with either the hands so that the rope is feet under the side of the ladder as he descends. When the bottom of the window still is reached, the rope with the thread of the back of the rungs up and over the 3 consecutive runs. This allows the rope to hang freely but not closely to the building enough for the rope is full and through the aid of the planned men of the ground to allow the sufficient length of it to be taken through the window where the tie is to be made. Usually about 20 feet is enough from the operation of the rescuers and steps from the ladder through the window opening the room and makes the tie of the victim. Also, after the tie has been made, the victim is swung from the window, lowered by the men from the ground holding the rope tightly. Section 7, First Aid.